You are watching Doug Austin of the Ice Capades perform one of his professional skating routines. Doug, like a number of other skaters we will see, specializes in high-velocity spinning. Such spins have several striking features. The skaters maintain perfect form and balance during the rapid turning movements and can confine the spins to an area of ice about the size of a saucer, if the ice is level and smooth. But perhaps the most striking aspect occurs when the skater, spinning at peak velocities as high as 300 RPM, comes to a sudden stop and shows none of the undesirable disorienting effects that such vigorous stimulation would induce in the ordinary untrained person. The organs specifically concerned with the responding to turning or angular stimuli are three pairs of semicircular canals. They are located in the inner ear and make up part of the vestibular system. Stimulation of the canals results in two primary types of reactions: a turning sensation or dizziness, often referred to as vertigo, and a repetitive pattern of eye movements called nystagmus, which can cause a blurring of vision. Figure skaters have been regarded by investigators to have suppressed so profoundly their vestibular reactions that they no longer exhibit any of the normal responses to semicircular canal stimulation. Because disorientation, dizziness, and blurred vision are significant problems in aviation medicine, a study of figure skaters was undertaken at the Civil Aeromedical Research Institute in Oklahoma City. The aim was to obtain a more thorough knowledge of how the vestibular system operates and to garner more information concerning methods of modifying and controlling undesirable vestibular symptoms. Let's follow Doug Austin, who performed for us earlier, and another Ice Capade star, Anne Margaret Fry, through the initial laboratory studies of the vestibular function of figure skaters. The skaters are given a brief account of the nature of the tests which they are about to undergo. For all of the tests, electrophysiological recording equipment is used to obtain permanent quantifiable records of the skaters' reactions. After cleansing the skin with alcohol, electrodes are taped near the outer canthi of the eyes to permit recording of the horizontal components of any nystagmus which might be elicited by the tests. The laboratory procedures followed here with Doug and Anne Margaret were also conducted on 4 other professional figure skaters. Electrodes are taped in position by Anne Margaret's eyes, just as they were with Doug. A ground lead is located on the forehead of both subjects. We are now ready to begin testing. The first tests to be conducted are those involving caloric irrigations. In this procedure, which is a common clinical test of the integrity of the vestibular system, water of a temperature either 7 degrees above or below that of the body is introduced to the ear. The water produces a temperature change inside the ear, which results in stimulation of the semicircular canals. Thus, unlike the situation in which the subject is rotated or spun, the functioning of the canals on each side of the head can be separately evaluated. Electrodes by the skater's eyes are attached to wire leads plugged into a terminal box, which feeds the eye movement signals to a recorder in the adjoining control room. Pre-test calibrations utilize special markers attached to a panel set into the ceiling. During instruction, the subject's ocular movements are obtained as they move their eyes from one marker to another. The device in which the skaters' heads are placed and elevated was designed in this laboratory to serve as a combined headrest, head elevator, and catch basin for the return flow of water during irrigations. The recording technician uses an intercom to give commands to the laboratory assistants. The start and end of the stimulus are carefully timed. Irrigations of the right ear are administered to both subjects simultaneously. For this test, the room lights are left on and the skaters are fixating on the cameras located about 2 feet above them. The stimulus is applied for 30 seconds. Close visual observation shows clear but not strong nystagmus from Doug. The recordings, however, indicate no apparent eye movement. Anne Margaret's nystagmus is even less discernible. One must look very closely to detect even a faint beat of eye movement. Eye closure results in much more vigorous responses. Of all the skaters tested in this laboratory, little or no nystagmus was noticeable when opportunities for visual fixation were present. Clear nystagmus, as depicted here, was consistently obtained when vision was not permitted. It is of interest, too, that the skaters report no sensation, or relatively mild sensations, even to bilateral caloric irrigations. Perhaps complete suppression of their responses is limited to rotational stimulation. Thus, the next series of tests involve a rotating chair. Electrodes plugged into a terminal box lead to a set of slip rings in the base of the chair, which allows eye movement recordings to be made in an adjoining room. A signaling device is given to Anne Margaret so that she may provide us recorded information about her sensations of motion. Eye movement calibrations similar to those previously described are obtained before these tests. The stimulus is a mild one, 5 degrees per second for 12 seconds. Lights in the test room are turned off. The subject, now sitting in total darkness, is told through an intercom that acceleration is about to begin. For demonstration purposes, Anne Margaret is being rotated here in the light. However, during all of our tests, and for all of the records to be presented, rotation trials were conducted in total darkness with the subject's eyes open. Anne Margaret is rotating now at 10 RPM. The small signals at the bottom of the recording paper indicate Anne Margaret's estimation of turns through 90-degree angles while rotating in total darkness. A clear, strong nystagmic response is evidenced as a result of the acceleration stimulus. The last 3 signals at the bottom of the record indicate that she no longer feels any sensation of turning. Another 90 seconds pass before Anne is decelerated from 10 RPM to 0 velocity. Here she reaches a complete stop. The bottom tracing indicates that Anne's turning sensation continues normally for several seconds after she has stopped. Nystagmic responses are also strong. Here Doug is prepared for a similar rotational test. Pre-test calibrations are also recorded. Lights in the test room are turned off. Doug is alerted for the impending start of acceleration, and recording begins. The stimulus is again a mild 5 degrees per second for 12 seconds. When rotated with eyes open in total darkness, nystagmic responses from all of the skaters tested in the Carey laboratories were strong, both to acceleration and deceleration, regardless of whether the direction of rotation was clockwise or counterclockwise. They all experienced definite sensations of angular movement. Doug's turning sensation continues after the acceleration stimulus has ended, and he is rotating at constant velocity. His responses appear similar to those of many ordinary subjects. The sensation of turning and the nystagmic eye movements eventually cease completely. After 2 minutes of rotation at 10 RPM, Doug is decelerated to 0 velocity. Vigorous, clear responses such as these were obtained from all skaters to a variety of different acceleration rates administered in total darkness. Note that Doug's subjective turning estimates have continued, although he is at a complete standstill. Since these laboratory tests run contrary to many existing views of vestibular function, further studies were conducted at an ice arena to ascertain the generality of the findings. It is possible that complete suppression of vestibular responses is specific to practiced conditions. Whereas in the laboratory, the skaters merely passively experienced angular motion, on ice, they actively induce and control the rotation by means of a thoroughly learned discipline of coordinated physical and mental activity. Our test can now be extended to the skating situation.